Hello, I'm Dr. Stephen Davidson, the Sexual Integrity Coach located in Wilton Manors, Florida. Welcome to another episode of Adult Sex Education. Today I'm going to speak to the subject of gay P&P, party and play culture. Before I do that, I really want to thank all of you who subscribe and comment on the videos. I take your comments and suggestions seriously, and you've given me some great ideas for future video topics. A subscriber recently requested that I speak on the subject of gay P&P culture. P&P is an acronym for party and play. It refers to subcultures of individuals who fuse recreational drug use with sexual activity. The primary substance is crystal meth, but the term can also apply to those who use ecstasy, GHB, cocaine, and ketamine. It's easy to get into this subculture of partiers, but it's much more difficult to get out. Anyone can participate in party and play sexual activity, but gay men are especially seduced by the ways recreational drugs are normalized and even glamorized within gay party culture. Rates of substance abuse have long been higher for gay men than our straight brothers. Sadly, gay men also experience higher rates of body dysmorphia, eating disorders, depression, and anxiety. Being a gay man comes with many challenges in life, and early on the substance use looks like a solution for coping. No one sets out to become addicted, and in the beginning it might seem like it's manageable until it isn't. Chem-sex is the term used by treatment facilities who specialize in helping men and women who have fused substance abuse with sexual activity and are now in a pattern where they can no longer engage in sex without substances. All sexual thoughts are paired with thoughts about using. Recovery is a long road of abstaining from substance use and trying to learn how to have sex sober. Those who fuse substances with sexual activity frequently report that sex was challenging for them before they ever used substances. They had sexual anxiety, low self-esteem, a poor body image. They felt unattractive. Some say they felt excluded from parties or events if they weren't using, and using was a way to get invited and make friends. The recreational drugs looked like their solution. It helped them manage their anxiety and negative self-talk. It helped them engage in and tolerate sexual activities that may have repulsed them when they were sober. Parties or events they once felt awkward at attending or didn't really enjoy being there were now euphoric experiences that they couldn't wait to repeat. It's sad and frustrating to see so many handsome and intelligent men think that this will be their path to happiness. Due to stereotypes and stigma associated with addiction, many people still think of addicts as unattractive, uneducated individuals who are just not smart enough to avoid the path to destruction. You might be surprised to know that anyone can fall victim to P&P culture, regardless of education, good looks, or socioeconomic status. Addiction doesn't discriminate. Some of the long-term effects of crystal meth use include paranoia, delusions, hallucinations, memory loss, increased anxiety, fatigue, depression, malnutrition, changes in skin texture and color, tooth decay with a blackening or rotting of teeth. It doesn't end as glamorous as it begins, and it's a club where you will eventually want to revoke your membership. As a sex therapist, I have over 30 years of experience coaching clients toward finding their sexual authenticity, their sexual integrity, whatever that might be. Regardless of sexual orientation, gender identity, or relationship styles or preference, I coach people to lean in to their sexual truth. Chem-sex is not leaning in, it's leaning away. There is nothing in the world of sex that cannot be enjoyed sober. If you can't enjoy it sober, maybe you don't really want to do it. Personally, I want to be drugged out of my mind if I'm having a root canal, major surgery, or my plane is going down at night over the middle of the ocean. But for sex, I want to be fully present. Substance use is not the solution to your anxiety, your poor body image, or your discomfort in social settings. It's not the best way to make friends, and it certainly will not help you achieve intimacy with anyone. If you are dealing with any of these concerns, I strongly encourage you to enlist the services of a therapist, preferably one who specializes in working with gay men. If you're already dealing with addiction and can't find your way out, please call the National Addiction Hotline at 1-800-662-HELP, HELP, for information and referral. For those of you who are currently in recovery, congratulations on finding your way out. I know it's still a day at a time, but you are the inspiration for so many other men and women who will follow behind you in recovery. I'm Dr. Stephen Davidson, the Sexual Integrity Coach. I hope you will like this video and subscribe to my channel. While I can't reply to all of your messages, I do read most of them, and I do consider your suggestions for future topics. I hope you will check out my website at sexualintegritycoach.com, where you'll find links to both of my books, Sexual Integrity, Finding the Courage to Be Yourself, as well as Peaceful Mind, Peaceful Life, the guidebook to happiness.